what a nightmare. It's truly a nightmare. Ectopic pregnancy in the Cesarian scar niche. Come and join me in this journey, which I call it Mission Impossible or scary movie journey. Here we are. This is the Cesarian scar niche. This is the defect of the Cesarian scar. And that's a product of conception. It's filling the pouch of the Cesarian scar defect. Putting in mind that the wall here is very thin, you're almost millimeter from the urinary bladder. And the attachment of the pregnancy sac, you cannot determine how much deep inside. So, and also there is no muscle wall here. So any bleeding will be catastrophic because there is no myometrial contractility for securing hemostasis. So also the tissues are degenerated. These are the chorionic tissues, and the sac is not obvious yet. Diagnosis was by ultrasound. There is a certain criteria to diagnose Cesarian scar ectopic pregnancy, that the cavity should be empty and the cervix also is empty, but the sac is filling the niche. Here I am using the Resectoscope, the 26 French, without electrocautery. So put in your mind here, my Resectoscope loop is like the curette, and you have to be exactly at the plane. So this will detach and peeling out the sac from its attachment. If you're not in the proper plane, you will leave still chorionic tissues attached, or if you go more deep with strong power and push, you will perforate into the bladder. That's why I'm not using electrosurgery here, only depending on the mechanical push in the proper plane of cleavage. And definitely bleeding here can make the field not clear. So judicious use of inflow, outflow for this is the sac. Yes, actually the sac is attached not straight anterior, but it's anterolateral. Now I'm trying to push, but apparently the sac is open. The sac was intact. You can obviously see that this is the amniotic sac, and I am searching now for the base because I am here inside the sac, and the fetal pole is like a peanut inside. Here I'm in the proper plane. Look at this view. How is the peeling, like an orange skin peeling. This is the proper plane. Some little bleeding, you can overcome this by stronger fluid pressure and irrigation. Look at this, look at that. It is exactly at the plane of attachment of the sac to the wall of the Cesarian scar niche. I want the viewer to imagine that the niche is anterior to it is the urinary bladder, but the pregnancy sac here is attached anterolateral to the left side. And this is technically very awkward. So I have to use the loop to, yes, here, this is the hand of my GPS. My beloved sunshine Yahya is telling, Dad, go a little bit more lateral. Actually, it's not easy as people think. And now the tissue's getting peeled more and more. Please watch. Imagine that you are the surgeon. I want your hands and your fingers to be working with me. Try to get the feeling and the ergonomic. Look at the beautiful peeling of the sac. I am operating here intracervical. So the fluid overload issue is not worrying at all. There is no electrosurgery, but the power of pushing the electrode should be very sensitive. Otherwise, perforation here, you will see the bladder mucosa. So watch, and I'm coming before the end with more and more stories, entertaining, teaching, building up skills and talents. observe the pregnancy sac characteristic. This is the pregnancy sac. And enjoy the beautiful sensation of peeling off. Yes, more. Push laterally, and you can see the membranes of the sac is getting detached out of the attachment to the wall of the niche. Every now and then I go a little bit back and I try to push the tissues by the electrode to make sure that it is free. The situation is very awkward. It's a very narrow space to work in, okay? So I go back and I touch the sac to see it's almost detached. It's almost detached. And thanks God there is no bleeding. Why there is no bleeding? Because when you go into the proper plane of cleavage, you avoid, like peeling the placenta after delivery of the uterus, without leaving remnants and without over curating and injuring the wall of the uterus. Here the wall is very thin. Again, look at this, look at that. A beautiful peeling off of the membranes. And the procedure, I deliberately provided the video non-edited, almost non-edited, so the total time not exceeding 12 minutes. So watch, enjoy. And here we come to the end of the story. The sac is completely peeled off. This is Osama Shawki from Cairo, Egypt.